Hey family, it's Dr. Yola. I wanted to come to you directly and speak about the Johnson & Johnson vaccine and these concerns around blood clots. I had an opportunity recently to speak about it on the Black News channel, but my audio and visual wouldn't let me be great and speak on it extensively, so I wanted to come to you guys directly. I want to talk about first what we know, what are the facts around it. The second thing I want to talk about is sort of what to look out for, what are the risk factors really for this specific clot in general, and then what are some of the symptoms in terms of this particular blood clot, and then what are the implications around the Johnson & Johnson vaccine, particularly in Black and brown communities. So let's talk about what we know first, all right? What we know is that there have been 6 individuals here in the United States who have developed a very specific blood clot, something called a cerebral venous sinus thrombosis, CVST, a blood clot in the brain. A lot different than our DVTs, deep venous thrombosis. Those are the blood clots that develop in our extremities, usually in our legs, and those blood clots can travel to our brains and cause stroke, to our hearts and cause heart attack, or to our lungs and develop what are called pulmonary emboli, which then can cause catastrophic damage to the lungs and sudden death. This is different. These clots are specifically localized to the brain. They're also associated with low platelet counts. So the platelets are the cells in the body that allow clots to form. And in these particular individuals, their platelet cell counts were actually low. Of the 6, all 6 were women. One has died. One, as of yesterday, was in critical condition. So that's the information that we know. We don't know a lot about their medical history or any of those things. That's likely part of the information that the FDA is gathering and part of the pause process for us to get a better understanding of what may be some common denominators among these 6 women. It's also important to know what is the risk of these clots in the general population compared to the risk from clot formation for these particular individuals with the Johnson vaccine. We know that 5 in 1 million people here in the U.S. can go on to develop a cerebral venous sinus thrombosis. We also see this happening in the pediatric population. 3 in 300,000 children annually can also develop this kind of blood clot. It's rare but not uncommon in pediatrics. We actually see it in the newborn period, particularly for newborns who are significantly dehydrated. We see this type of blood clot formation. So 5 in 1 billion people have a risk of developing this blood clot in the general population. Based on current numbers here in the U.S., with 6 individuals receiving it out of the 6.8 million people who have received the Johnson & Johnson vaccine, that's a risk of about 1 in 1 million. So we always want to make sure we're comparing the risk in the vaccinated population to that in the general population to determine whether or not the risk is at least equal, if not higher, in the vaccine population to indicate that the vaccine itself may be associated with an increased risk of developing this kind of blood clot. As of now, the risk in the vaccinated population is still significantly less than that in the general population, but we also want to continue to collect data to make sure that there aren't other cases of this clot formation that we may not have been able to observe until now that we've identified at least 6 individuals. This is very similar to the clot formation seen with the AstraZeneca vaccine in Europe. So part of the investigative process will likely also include looking at similar factors in the AstraZeneca population of people who developed blood clots during this period. Now, it's interesting that both the AstraZeneca and the Johnson & Johnson vaccines are based on older school historical development of vaccine technology, the DNA-based vaccine. So it'll be interesting to see what are the factors that are universal between these two and the populations of people who have developed these blood clots. And the question is really, in terms of what we need to know, is are there common denominators? Are there common factors within this population of 6 women between the ages of 48? Maybe they all use the same medication, have similar family histories in terms of risk of clotting disorders. They may have similar personal histories in terms of some of these issues. That's part of the work of the FDA to figure that out, as well as Johnson & Johnson, clearly. Because in terms of this particular blood clot, there are certain risk factors in terms of developing this kind of blood clot. In the pediatric population, those risk factors include significant dehydration, as I just mentioned, blood disorders like sickle cell anemia, beta thalassemia. There's certain infections that can increase the risk of a CVST being developed. In the adult population, obesity is a risk factor. Collagen vascular diseases such as lupus are a risk factor for this kind of blood clot. Other risk factors include disorders with blood clotting. Factor V Leiden deficiency, which is the most common inherited hypercoagulable, meaning you develop clots very easily, disorder. That's the most common inherited one. There's something also called antiphospholipid disorder that increases your risk of developing clots. Protein S and protein C are components in clotting that when you have a deficiency, it also increases your risk of clotting. So there may be some family history of this, or for yourself personally. These are all issues to identify, particularly if you have recently received the Johnson & Johnson vaccine. One of the other things to make note of is that it wasn't immediately after receiving the vaccine that these 6 women developed these blood clots. It was anywhere between 6 to 13 days. So for those of you who have received your Johnson & Johnson vaccine like 3 weeks ago, as of what we know now, you don't have to necessarily be worried. But for anyone who's recently received the vaccine, it's definitely something to pay attention to. What we know after getting a standard vaccine is 24 to 48 hours afterwards. It's not uncommon to get fever, some soreness, particularly at the injection site, maybe even a little bit of headache and full body just achiness, almost mild flu-like symptoms, right? That's par for the course in terms of your body's response in creating an immune reaction to the vaccine. I just got my second COVID-19 vaccine just on Friday and experienced some significant soreness of my arm and a migraine headache that lasted for 2 days. What we're talking about with this clotting issue is 6 to 13 days afterwards. So you want to be mindful of the following symptoms. Paying attention to headache, right? I know my history. I received Moderna, so it wasn't an issue for me. But if you got a Johnson & Johnson vaccine and you develop a significant headache between between a week to 2 weeks out, pay attention to it. Don't ignore it. Don't just take an Excedrin and go on about your business. You want to be cognizant of your headache and reach out to your healthcare provider to make sure that you are connected with them to figure out what to do next. The other issue, particularly with this particular clot, is that all of them were associated with low platelet counts. And usually with clotting disorders, there's usually elevated platelet counts. So it's interesting that these individuals have low platelet counts. But you want to pay attention to headache. You want to pay attention to anything neurologically that's different. Double vision, blurred vision, loss of consciousness, changes in how you sense things, either tactile, meaning you can't feel touch as much, pain, if you lose strength, capacity to move in any of your limbs, you want to make sure that you seek out attention. Do not assume that you just slept funny on your elbow. Reach out to your healthcare professional at minimum. If need be, seek out attention. Go to the emergency department. Now, I don't want everyone who's gotten a Johnson & Johnson vaccine to immediately go bum rush an emergency department. But if you're experiencing significant neurological symptoms, be aware of what they are in terms of significant headache, blurred vision, double vision, change in how you sense everything, touch, pain, etc., decrease in how you're able to move. Those are the things you want to look out for. Make sure you communicate that to a loved one as well, particularly if you live alone, so that they know to check in on you. All right. So those are the things that we want to keep an eye out for. And part of the reason why the FDA put a pause on it is, one, because it's concerning, right? The second is to allow healthcare professionals to be on alert for these symptoms, because the standard of care when people present with a concern for a blood clot is that we put them on heparin. For this specific blood clot, a cerebral venous sinus thrombosis, you do not want to start the patient on heparin. And I say that to you guys so that you will know how to advocate for yourselves and your loved ones. If they get ready to put the patient, your loved one or yourself, on heparin, ask them, have you ruled out a cerebral venous sinus thrombosis? If not, we can't do heparin yet. All right. So I want you guys to be able to advocate for yourselves. And just Also knowing what those risk factors are, keeping in mind those are the risk factors that we talked about in the pediatric population are for cerebral venous sinus thrombosis in general, and same thing for adults. But we don't know yet if you have one of those disorders, does receiving the Johnson & Johnson vaccine put you at even higher risk of developing the clot? Again, that's a conversation to have with your provider. If you were to ask my opinion, I would tell you, if you could, to opt for Moderna or Pfizer for right now until those questions are answered. And that really leads me to the implications, right? How does this impact us collectively, particularly in Black and brown communities? What we know is that the Johnson & Johnson vaccine has been placed in what people have classified as hard to reach communities, right? Rural areas, underserved populations, where logistically we know that the Pfizer and the Moderna vaccines require significant logistical issues, right? Sub-zero freezers. The Pfizer vaccine, once you thaw it, is only good for a couple of hours. For the Moderna, it's only good for a couple of days. So the Johnson & Johnson vaccine seemed to be ideal in these more challenging areas. What it also means is that African American, Latinx, Native American communities may have been disproportionately given the Johnson & Johnson vaccine. And certainly we can have our own issues about that in and of itself, given the decreased efficacy, but we balance the decreased efficacy of the vaccine compared to Moderna and Pfizer with improved logistics in terms of being able to make it more readily available. So the first question is, logistically, what will be done in the meantime, in between time, while we're getting these questions answered? How are we collectively going to equitably make sure that people have access to Moderna and Pfizer while we're still getting the question answered about Johnson & Johnson? And then, because we've had concerns, one about the efficacy of the Johnson & Johnson vaccine compared to Moderna and Pfizer. And then just a couple of weeks ago, the Johnson & Johnson, one of the factories, had some issues in terms of contamination. And now with this concern about blood clots, how do we address the concerns within communities of color around safety issues involving particularly the Johnson & Johnson vaccine, especially if the FDA decides to remove the pause and continue to use the vaccine? How will we collectively and comfortably as communities of color willingly and openly and with open arms accept this vaccine as the vaccine of choice in our communities? Especially if it's predominantly the one placed in our communities, that's going to raise some significant concerns, and it's something that needs to be addressed. I think that all of us should have equitable access to all of the vaccines. So there should be as much Johnson & Johnson in Bethesda as there is in Suitland. And I'm using examples here in Maryland because that's where I live. So those are the kinds of conversations that we need to have, particularly when some of the risk factors associated with this clot development are linked to African American communities. We know that African American communities are disproportionately impacted by sickle cell anemia, beta thalassemia, obesity, and collagen vascular disorders like lupus. So how do we address those issues within the use of the Johnson & Johnson vaccine? All of those are questions that need to be asked, and they need to be answered by the FDA, the CDC, Health and Human Services, and healthcare professionals like myself. But I want to make sure that you guys are updated on all of this information, and that you know what important questions to raise as we move forward. As I learn more, I will definitely come and talk to you guys about it and keep you updated in the way that I know how. I hope that this information is helpful. I'll see you guys soon. Dr. Yola out.